Mr. Checkett. I'm Katie. I'm going to be your nurse today. Can you go ahead and just state your name and date of birth for me? Okay, awesome. Thank you. So we have noticed that you are having a little bit of difficulty swallowing, and so you're not getting enough food in your stomach and enough nutrients in your body. So we have decided that we're going to need to put in a nasogastric tube, which is basically a little tube that's going to be stuck up through one of your nostrils and go down into your stomach. And that way we can feed you through the tube and you're not going to have to worry about aspirating when you swallow. So the first thing I'm going to go ahead and do is I'm going to listen to your bowel sounds, see how if they're working. Alright, Mr. Checkett, that sounds great. We're just making sure that once we do get food into your stomach that your body will be able to digest it. The next thing I'm going to have you do is plug one of your nostrils and breathe in and out through the other one, and then go ahead and switch and do the same thing. And basically I'm just checking for air passageway so we know which one the tube is going to go up easier. So can you tell me which nostril it feels easier to breathe through? Your right one? Okay, so we'll go ahead and put the tube up through your right one. Do you have any questions for me so far, Mr. Checkett? Okay. Now with this procedure, what I'm going to do is stick this small tube that's right here. It's flexible, so it's going to go down. I'm going to stick it up through your right nostril. And when I do that, I'm going to have you tilt your head back, and that's going to open up your nasal passageways and help it go through a little easier. And then you are going to feel it in the back of your throat. And once you do, I'm going to have you tilt your head forward and put your chin on your chest. And that way, we can get this tube down. And when I say swallow, I'm going to have you swallow, and I'm going to put it down a little further each time. And again, that's just to make it go down easier, and I'm going to try and do this as quickly and painless as possible. And you are most likely going to feel the urge to cough and possibly vomit, and that's completely normal and okay. So if you do, don't worry about it. And we've got this basin right here in case you do need to vomit. Alright, I'm going to go ahead and put some lube on the tube. Do you have any last minute questions about the procedure or anything? Alright, so we'll just go ahead and get this started. Like I said, I'm going to have you tilt your head back. Alright, here we go. Okay, now tilt your head forward and go ahead and swallow for me. Awesome. Swallow. 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 And one last big one. Good, it's down there. I'm going to tape it in place. Does everything feel okay, Mr. Checkett? Good. And once it's taped in place, I'm going to do a couple of tests just to make sure that we did get it in the right area. So the first thing I'm going to do is I'm going to take some of your gastric fluids out of your stomach and just check it for color and pH. Alright, so it's good green color, that's what we want. I'm going to check the pH now. And the pH is a 3, which is good for your stomach contents. I'm going to stick it back in. Alright, so check it. So the last thing we're going to do is we're going to take you to get an x-ray, and that's just to confirm that I did place the tube in the correct area. And once we do get it confirmed that it is in your stomach, we will be able to start your tube feedings, and hopefully you'll start feeling better. So is there anything else I can get for you or do for you? Okay, Mr. Checkett, well have a good day.